I am here with Sir Graham Thornicroft. Nice occasion to ask about reform in Czech Republic and all the way. For our movement of peers, is somehow difficult to hear that the reform is not a thing of only involvement, but it's also a systemic work. May this be the first question? How?
Thank you, Tomáš. So first let me say how pleased I am to be here in Prague this cool November day, and to be, I hope, contributing towards the discussion and then the implementation of reform of mental health care in the Czech Republic. So as you know, this is a very ambitious program and wants to rapidly increase the facilities, the support, the help available to people with different types of mental health problems across the whole country. The current situation is somewhat mixed because there is also the legacy of the services from Soviet times, particularly the large hospitals, and there are many examples of new services to support people in the community. Now, some of these, which are very important, will be peer support or peer-based involvements, such as your own media company. And this has a number of advantages. For example, it gives people the opportunity to learn skills that may lead on to competitive and open market jobs as well. It gives people who have experience of mental ill health, maybe now, maybe in the past, a chance to have a direct voice in talking with other people, including policymakers, but also healthcare staff, about the importance of issues from the service user perspective. And in the whole process of reform, it's very important that people keep a very close eye upon the priorities, the needs, the preferences of service users to strongly direct the direction of the reform at every stage as the reforms go ahead.
Thank you very much for this nice word. Maybe the question is if the people are doing that really.
Well, to give you one example from my experience, so I led a process of reform in my country, in England, with a national mental health plan. And I remember we had about 70 people, many stakeholders involved in the group creating the new plan. And I think about 10 or 15 were service users. And those people said, we're angry, we're not happy, because we demand that a majority of all the people involved in planning the new program of care are service users. But I also had to say, many people here who are not describing themselves as service users, of course, will have experienced mental illness, but are deciding not to speak about it. Because of stigma, many people, in fact, I think most people who have experience of mental ill health decide to keep that quiet and to keep it a secret. So that some people who are deciding to speak out openly about their experience are, if you like, pioneers, but many others are with them, even if quietly or silently.
Maybe also for the service users, it's sort of difficult to attend these not only conferences but also some government groups for implementation of something. We are more straightforward somehow than to...
So in any country, let's imagine, we're speaking now about the Czech Republic, it's one thing to say that service users should be involved, but it's another thing to actually make the practical arrangements for meaningful and long-term service user involvement. So for example, people need to have a place to meet. They may need particular rooms. They may need very practical support like computers, photocopiers, phone lines, the office support to be able to run a service user group. Then let's imagine that there's a governmental committee or a policy group which wants service user contributions. So then it's the responsibility of the government to actively support in very practical ways how service users can make a useful contribution. For example, explaining all the abbreviations, explaining the different parts of government, explaining what laws or acts are, and not assuming that people will understand the complicated sort of shorthand of government documents, explaining how committees work, about how decisions are made, about where different proposals go if they are to be accepted and then to be implemented. So people understand, if you like, the mechanics or the workings of government, which for the outsider can be very difficult or indeed impossible to understand. Now also people may need that support before a meeting, but also may need active support after each meeting. Perhaps service users want change now. The minister says, well, in 5 years' time we can look into that. And then people may be feeling upset or angry or disappointed because they've been waiting years and they want change immediately. But governments don't work immediately. Governments are like sort of glaciers, slow-moving things that, there's a speed, but it's quite a slow speed. So people have to understand then, if you like, what is realistic, and not to think that governments can do everything. So quite often governments can set a policy, but they need other organizations, maybe service providers, maybe not-for-profit organizations, maybe international donors, maybe European Union, to also play a part. And typically a big change, like a reform process in mental health, requires many stakeholders to work together. Now, for example, let's think that some people who are long-stay patients in a large hospital would be better, have a better quality of life living in the community. Typically, the health ministry doesn't have houses in the community. So, and typically a health ministry doesn't want to provide housing. They say, we do health, we don't do housing. So then they either have to decide to change and that they will provide houses, or they talk to the housing ministry or the Ministry of Social Affairs and say, will you work with us? And they say, we don't have a budget, that's a health problem, that's not our responsibility. Maybe they have no history of working successfully between two ministries, and maybe there's education ministry, employment, corrections and justice. So there may be a need to collaborate in different parts of government, which hasn't happened before. You've got to create not just services on the ground, but also agreements for the funding and responsibilities. Now, from a service user perspective, this might seem to be time-wasting and slow and people avoiding responsibility. But from a governmental point of view, it's a necessary way of planning the future for services where many services are outside hospital. And it requires a type of collaboration between parts of government that may have to start, which has never happened before, and may start slowly before people begin to know their respective counterparts and before they begin to trust if they will actually make agreements and then fulfill their agreements as well with actual cash, with actual money.
Thank you. And maybe the last question. I very much admire British campaign. I think it heads together where the people from Harry, William and Kate speaking in the garden. I don't know if you know this. And I think that this is very difficult to do something like this because it's a very civil video, or how to say it. They are speaking normally like people who know each other, but they are also the British royal family. And I don't know if it is possible in Czech Republic. We have now a similar causa. I don't know if you know about that, but the public debate is completely different. It's not that cultivated cultivated.
So we have seen in recent years big progress in cutting stigma in England, in my country. And one of the important developments has been, as you say, this new charity. It's a not-for-profit organisation called Heads Together, led by Prince William and his wife, Kate Middleton, and his brother, Prince Harry. And interestingly, not only have they supported stigma reduction and better mental health, Prince Harry has also discussed his own mental health problems. So he describes having been very negatively, emotionally affected by the death of his mother, Princess Diana, when he was just a young man. And also typically for men, not asking for help for a long, long time. Many men think it shows weakness if you have a mental illness. It shows weakness if you ask for help. So he took many years before he went to get help. He then had, I think, psychological support and was able to come out of his period of mental illness. And he now speaks about that openly, without shame and without embarrassment. And some people have described the royal family in my country as the most famous family in the world. So to have them speaking openly about mental health is a very positive step forward.
Yes, we translated it for our recovery college in Prague, this video, and it makes a big impression. So thank you very much for your words, and hope that you will keep an eye on Czech reformic efforts and so on. Thank you very much.
And I wish you very good luck with your work as your group as well.
Thank you.